You know, this is just so important. It's something that we don't talk about enough, and that's investing in you, taking the time for you, the healthier you. We're focusing really on breast health, but I guess if you think about it, Beth and Catherine, it resonates to the entire body. I mean, if you're thinking about breast health, you're thinking about the entire body, the temple as you call it. Which your husband worships, right?
No, I don't know, not enough. Genuflect occasionally.
Kiss the ring. What is the program, though, that you have at Holy Redeemer? Because it is great when you're a health system so that you want your employees to think about health and create that culture.
Right, so we have a program, it's called Healthy You, and it's a program that's basically, we're trying to reward people for basically good behavior, right? Yeah. So you're rewarding people for exercising, for going to doctor's visits. I mean, how many times do we think about, for me, for example, when's the last time I went to my primary care doctor? Well, it's probably been a while because I've had other things to do. So we reward people for going to their primary care doctor, for getting the screenings that they should have, and then also for exercising. So the Healthy You program was basically people had pedometers, they worked out, they logged their hours of exercising, and it was a big competition within the hospital system to see whose group was going to win the competition. And so unfortunately,
Best Barbell Babes came in third.
But that's pretty good.
But we had a good showing, and it raised the awareness in our office because we take care of patients all day long, and I'm pretty good about exercise and wellness, and I'm trying to inspire other people in the office. And you know, it's bad when I walk in the lunchroom and the potato chip bags are being thrown in the trash can because
she told us we can't have it anymore.
I just said that we need to set the example for our patients as well. But the Healthy You program's given us a platform as a health system to say, okay, let's put your money where your mouth is. If you follow these guidelines and you do invest in your health, you get some of that investment back at the end of the year as a rebate from your insurance. So instead of fining people for not being healthy, we are rewarding them for positive behavior. Funny how that happens.
Yeah.
Well, the carrot it's a great idea instead of the stick.
Yeah, the carrot's a whole lot more effective for us than the stick.
It is.
The stick on the butt, you know.
I got it. So what's your workout? I mean, you work out with a trainer? Do you run? What are you doing?
I do a cross training program with Von Hebron. It's pretty intense. It's 45 minutes of very intense, fast cardio, a lot of core, a lot of push-ups. Not that I'm going to drop and do some for you here, but I could. But what it's done for me is it's created a routine that I have accountability in a group. There are people there that I work out with every week. And now we have our patients, our VMS Thrivers, are our group of breast cancer thrivers, women who've gone through breast cancer, and they come to this workout and they've adopted a healthy lifestyle because of it. And so what we've done is it's another program through the foundation. We give them 8 weeks free. Like, we give you Vaughn for 8 weeks. It's your choice what you choose to do with it. And for women that can't afford it, we continue to subsidize them because we believe in their health and wellness as something that it's worth investing in. Because the healthier they are, the less likely we are to see a recurrence in their cancer.
Do you think that some of the fads hurt us? You know, no carbs, don't do too much cardio, all the different fads that aren't that holistic view of health.
I really believe that the diet fads really hurt us because you see women who say, okay, I'm going to start juicing and I'm going to juice for a week. And then, so that's great. You drink all these healthy things for a week. And then what do you do when you finish your week? You go back and you go and you have your ice cream or your potato chips or whatever it is. It doesn't change how you eat. It changes what you did for a week. And what we really need to work on is just changing overall how do you cook at home? What do you eat? When you go out and you're at a restaurant, what choices do you make? Because there are healthy choices and there are unhealthy choices. And if you're always on one of the fad diets, so you're on the low carb diet or these incredibly high protein diets, that's not something you can maintain for the rest of your life. You need something that you can maintain. Same thing with exercise. If you can find a way to fit the exercise into your normal routine, you can maintain that. Where if exercise is a chore and you say, oh man, I have to go work out today again, you're not going to maintain that.
Yeah, and I think
that's why it became social for me. I mean, exercise became a social event because these are people that I'm friends with now.
So now it's fun.
And it was about life transformation. I was not exercising regularly. I was, as my trainer called me, skinny fat. I love him for that. He said, Doc, you were all jiggly, Doc. And although I weighed less than I weigh now, jiggle like I used to.
Because muscle weighs 3 times that of
You
fat.
got it. So it was that transformation, and that's where what we're trying to do is create transformation opportunities. The healthy cooking program, the exercise program, allow people to slowly transform their lives, because a diet is a 4-letter word. And if you go on a diet, people that yo-yo diet end up gaining more weight, because a lot of times they lose it quickly because they're not losing real fat, they're killing their muscle, and then they boing back up. So those steady life transformations are things that can make a difference.
We're going to talk more about transformations when we come right back. So it's all about the transformation and the new you, or the better you, however you want to look at it. But I think this is so important, because how often do you say to yourself, I'm taking care of the kids, I'm taking care of the husband, I'm the caretaker, but what about you? And that's really what we want to talk about, and what we're focusing on with our friends from Holy Redeemer, Dr. Beth DuPree, Dr. Catherine Carruthers. It's so good to have you here, and I think we can't spend enough time dedicating, just getting people to focus on that transformation. It's so important.
I think it's one of the most important gifts that we give our patients. They may come to our office with a breast issue, but even in our patients that aren't diagnosed with cancer, we help to give them the tools to live a healthier life, to make those changes that they can potentially make, to not show back up in our office with something that requires further intervention.
I know that a lot of times you've said that you have people, when they go in for the mammogram, and they say, well, why can't I just get an MRI, because we hear about this? You say what?
Well, the MRIs they're very useful screening tools in certain women. So women who are considered high risk of breast cancer, and we can calculate that a bunch of different ways. We look at their age, how old were they when they had their periods, did they have children, did they have a biopsy, a lot of different things. So women that are considered high risk of breast cancer, an MRI is a useful addition to their yearly mammogram. But what we know about MRI is that MRI has a lot of false positives, meaning that a lot of things show up on an MRI that end up being nothing, so it causes a lot of anxiety. And it also doesn't pick up some of the earliest breast cancers, the things that if we find early, we can treat and prevent future breast cancers.
I know that, initially, Beth, I think the last time you were on the Dawn show, it was Angelina Jolie, and you were saying that was good for awareness, but on the other hand, people are saying, well, can't I just get the BRCA testing, or can't I just do this or that? So there's a backlash to it as well.
They came in wanting genetic testing, not really knowing that if you don't meet certain criteria, it's senseless to test. First of all, you have to have, before we test someone, we do certain calculations to determine what their risk of carrying the gene is. If someone doesn't have higher than a 10% chance of carrying the gene, it's really not worth testing them, because we're then spending healthcare dollars on things that we have a very, very low risk of being, finding a positive. And so what we do, we actually have a fabulous genetic counselor, Jessica, who works with us hand in hand. And when we identify patients in our practice on a daily basis that have those red flags, those things that Dr. Carruthers talked about in our last show, the mother with breast cancer at a young age, triple negative breast cancers, male breast cancer, ovarian cancer, when we identify those patients, we then can say to Jessica, okay, let's sit down, do a family tree, and determine whether or not this person should actually be tested. Unfortunately, after Angelina came public, a lot of people and a lot of doctors' offices just sent the test in because patients wanted it, even though it wasn't going to get approved by insurance, and it actually made a backlog. So we got our test results a little bit later for those first month or so after that happened, because Myriad had this unbelievable onslaught of people wanting testing. And so it's really about finding doctors that are going to look at you as a complete whole individual and not just knee-jerk send off a test, because if you're not going to do something with the test, you don't send it and you don't do it. And make sure that you identify what that person's risk is so you can give them appropriate treatment, not just a piece of paper with a test on it.
Is that part of the CBE, the clinical breast exams? Is that?
The clinical breast exam is really more focused on actually us examining the breast, but a part of a breast, like a visit with your breast health doctor, is absolutely looking at your genetic risk. So if a patient comes into our office and she's there maybe just for a routine exam, she's not had breast cancer, but she has some risks, we go over their family history again, because things can change from year to year. We do a full clinical breast exam, so we're looking for lumps, we're looking for thickening, we're looking for nipple discharge, we're looking for breast pain, anything that seems unusual. Now the good news is most things we find on clinical breast exam are not breast cancer. So we always want to try to encourage women that if we find something, that doesn't mean the worst, but we still want to look into it further. So the clinical exam is more what we do physically, but the whole visit is empowering the woman and looking at all aspects to find out what her true risk is.
Well, you know, Beth and Catherine, we can't thank you enough because your visit and all of your words and all of your energy are just so empowering. So thank you so much. I think we all learned from it. Now get out there and be a healthier you.